have you ever stopped to think about how sound actually works? I mean, how does random vibrations in the air, like music, someone talking, or even the noise of traffic, somehow get turned into something your brain understands as sound? It feels automatic, but the process behind it is incredibly precise and honestly kind of mind-blowing, because your ability to hear depends on this small, complex system deep inside your head, where tiny bones vibrate, fluid waves travel, and microscopic hair cells convert mechanical energy into electrical signals. And if any part of that chain fails, even slightly, you start to lose your ability to hear. So in this video, we are going to go through exactly how that process works. We will look at the external ear, the middle ear, the inner ear. And by the end of this video, you will have a full understanding of how your body lets you hear the world around you. What's up everyone, my name is Ty. I'm a medical doctor and I make animated medical lectures to make different topics in medicine visually easier to understand. If you would like a PDF version or quiz of this presentation, you can find it on my website along with organized video lectures to help with your studies. Alright, let's get started. So we will begin with the external ear, and this part is made up of three main components: the auricle or pinna, the external acoustic meatus, and the tympanic membrane. Let's go through each of these, starting with the auricle. The auricle is the visible part of the ear that sticks out from the side of your head. It is made up of elastic cartilage, which gives it the flexibility to bend forward, upward, or twist in any direction and still recoil back into position. Now, externally, we divide the auricle into several anatomical landmarks, and I recommend you to feel those structures on your own ear as we go through them to activate more areas of your brain for stronger memory formation. The outermost rim is called the helix. Just inside of that is a ridge called the Antihelix. Between the two, there's a narrow groove known as Scapha. Closer to the center of the ear, we've got the Concha of the auricle. That is the bowl-shaped depression that leads directly into the ear canal, and it helps to collect and funnel sound. Then we've got the Tragus, that small protrusion just in front of the ear canal opening. Across from that is the Antitragus, and between them is a little dip called the intertragic notch. And at the very bottom, we have the lobule of the auricle, the soft earlobe, which is unique in that it doesn't contain any cartilage. These structures are actually clinically useful too. For example, the tragus is often used in exams for signs of otitis externa, that is inflammation of the external ear, where pressing on the tragus can cause pain. That is one of the classical findings. Right beneath the skin of the auricle, we have a few more important structures. There's the extrinsic auricular muscles, which attach the ear to the skull. Then the intrinsic auricular muscles, which are small muscles within the auricle itself, but these don't have a real function in humans. You will also find the auricular cartilage making up the core of the pinna, and nearby runs the facial nerve, or cranial nerve 7, which provides motor innervation for the muscles of the facial expression, including some around the ear. One more thing I want to mention here is the sensory innervation, because the external ear has a very interesting nerve supply. At the top portion, we have the anterior auricular branches of the auriculotemporal nerve, which is a branch of the mandibular nerve of cranial nerve 5. The backside of the auricle is innervated by the lesser occipital nerve from the cervical plexus. Then down at the bottom, there's a great auricular nerve, also from the cervical plexus. And the rest is covered by the auricular branch of the vagus nerve, which is why stimulation of the external auditory canal can sometimes cause a vagal response like coughing, as weird as it sounds. So that was the auricle. Now let's go inside the ear and look at the external acoustic meatus. The external acoustic meatus is the ear canal. It runs from the outer ear to the tympanic membrane, and anatomically we divide it into several parts. At the opening we have the external acoustic aperture. Just after that is the cartilaginous portion of the canal, which makes up the outer third. Then deeper inside is the bony part, which makes up the inner 2/3 of the canal. These two regions also differ in sensitivity. The bony part is more sensitive to pain, which is important to remember when examining the ear with an otoscope. Next to the tympanic membrane, we have the tympanic sulcus and notch, which helps anchor the eardrum to the walls of the canal. Now, along the skin of the canal, especially in the cartilaginous portion, you will find ceruminous glands. These are modified sweat glands that produce something called cerumen, which is also known as earwax. The earwax is slightly acidic, and what it does is that it's specialized to trap things like dust, bacteria, and other particles, helping to protect the middle and the inner ear. So that was the external acoustic meatus. Now, let's cover the last segment of the external ear, which is the tympanic membrane or eardrum. And it's easiest to understand if you look at it from this direction and then isolate it. This is what your eardrum looks like. Now, around the eardrum, we have something called the fibrocartilaginous ring. This is a thickened ring that basically holds the eardrum in place within the tympanic sulcus. Now, the tympanic membrane itself is divided into two main components. We have the pars tensa, which is a very, very heavily dense, fibrous, irregular connective tissue. The other one is called the pars flaccida, which is the upper loose part of the tympanic membrane. And this is important because if you go and stick a Q-tip into your ear and you accidentally hit the pars flaccida too hard, you can puncture the tympanic membrane. And that would affect the middle ear pressure, as well as open up for certain type of microbes to come in. Now, another thing we see is that we can actually see an outline of the malleus, which is one of the ossicles located in the middle ear. But what it does is that it is pushing towards the tympanic membrane and forming an umbo of the tympanic membrane. It forms the mallear stria and the mallear prominence. Imagine now that you're going to assess the eardrum. So what you do is that you shine light into the external acoustic meatus. You should be able to see all of those structures, and as you do this, you should be able to see a reflection, a light reflex or cone of light, which basically is a reflection that once it's visible, it indicates a healthy eardrum during an otoscopic examination. So that was basically all three parts of the external ear. We finished the external ear. Now let's do the middle ear. So let's zoom in. When you look at the middle ear, the first thing to understand is that it contains three tiny ossicles arranged in a very specific way to help transmit sound from the eardrum into the inner ear. These are the smallest bone in the human body, and without them, we wouldn't be able to perceive sound at all. And the first one of those three ossicles is the malleus. The malleus has a head, a neck, and then a long process called the handle of the malleus, which is the part that actually attaches to the tympanic membrane. That's the structure we saw earlier, forming the mallear prominence, the mallear stria, and the umbo. So every time the tympanic membrane vibrates, that handle of the malleus is the very first thing to pick up that motion. From the malleus, the vibration continues to the next ossicle, the incus. The incus consists of a body, a short limb, and a long limb. And that long limb is important because it directly articulates with the third ossicle, the stapes. The stapes has a head, an anterior and posterior limb, and then a flat portion called the base of the stapes. And what the stapes does is that it sits right on top of the oval window, which is the entrance into the inner ear. So right now, as you're hearing my voice, or any sound for that matter, the sound waves of that sound is traveling through the external acoustic meatus, striking the tympanic membrane and causing it to vibrate. Those vibrations are then passed from the tympanic membrane to the malleus, then to the incus, and then to the stapes. And each ossicle amplifies that vibration slightly before the stapes finally pushes on the oval window and sets the inner ear fluid into motion. We will talk about fluid movement in detail later in this video because that is where sound or mechanical energy is transformed into electrical energy. But before we move on, there's also an important protective mechanism here. Imagine for a second that the sound is suddenly very loud, like a sharp, unexpected noise. That kind of strong amplitude would cause significant vibrations of the tympanic membrane, and if nothing helped regulate it, the membrane could actually be damaged. And to prevent that, we have a small muscle called the tensor tympani muscle, which attaches the malleus and tightens the tympanic membrane to reduce the force of vibration. Now, the middle ear is a cavity, right? And this cavity has walls. On the lateral wall, we have the tympanic membrane, the one we just talked about. On the medial wall, we have the inner ear, and anteriorly, we have the auditory tube. Now, the thing is, the middle ear is actually an essential part of the temporal bone, and what makes it even more important is that many structures pass through it. If you look at it from this angle and then remove the facial bones, we will be able to see the temporal bone. And coming off from this bone on the anterior side is the auditory tube. This auditory tube has two distinct parts. There's a lateral bony part, which is rigid, and then medially we have the cartilaginous part, which is a bit more flexible. This tube extends all the way into the nasopharynx, and its job is to equalize the pressure between the middle ear and the outside environment. Now, the ear structures are located deep within the petrous part of the temporal bone. As you see here, we can see parts of the external ear, the middle ear, and the internal ear. Let's zoom in for a moment. Can you see the middle ear structures now? You can see the tympanic membrane forming the lateral wall, and behind it we have the malleus, the incus, and the stapes. And you can also see the tensor tympani muscles originating from the cartilaginous part of the auditory tube and inserting on the handle of the malleus. So, this is the middle ear. I know I'm overemphasizing this, but I'm doing it for a reason. So imagine this. Let's say you casually walk across the external acoustic meatus. What are you looking at now? You're looking at the tympanic membrane, right? And remember, that membrane is the lateral wall of the middle ear. Make sense? Now, let's go ahead and remove the tympanic membrane. Imagine we've taken it out completely. That means that you're looking directly into the middle ear cavity. What you're seeing is the cavity formed by 6 walls. You've got the medial wall, the superior wall, the posterior, anterior, and the inferior wall. The medial wall is called the labyrinthine wall because it is the one that's directly facing the inner ear. The superior wall is called the tegmental wall because it's formed by the tegment tympani, which is a thin plate of bone separating the middle ear from the cranial cavity above. The posterior wall is the mastoid wall, which connects to the mastoid air cells. The anterior wall is known as the carotid wall because the internal carotid artery runs right in front of it. And the inferior wall is called the jugular wall because that's where the jugular bulb of the internal jugular vein lies just beneath it. So that whole cube you're looking at, that entire space is the tympanic cavity. So I've removed all the ossicles just temporarily so we can see everything more clearly. And what I want to do next is take you through each wall one by one and talk about all the landmarks and openings related to them. Because if you understand these, it becomes way easier to mentally navigate the tympanic cavity. And it will help you recognize what goes in, what comes out, and what's at risk during infections or surgical procedures. Let's start with the labyrinthine wall, which again is the medial wall facing the inner ear. First, there's the promontory, which is a rounded bulge created by the first turn of the cochlea. Then, just above that, we have the oval window, which is the opening where the base of the stapes sit. Just below the promontory is a round window, which is covered by a flexible membrane called the secondary tympanic membrane. These structures will make sense a little later in this video. From the inferior wall of the tympanic cavity, there's a small opening called the tympanic canaliculus, and through that we have the tympanic nerve, which is a branch of the glossopharyngeal nerve, cranial nerve 9. The tympanic nerve enters the middle ear through the canaliculus and then spreads out over the promontory and forms a nerve network called the tympanic plexus. Now, from that plexus, we get a branch called the lesser petrosal nerve. This nerve exits the middle ear through its own canal, the canal for the lesser petrosal nerve, and continues its path towards the otic ganglion, where it eventually synapses and contributes to the parasympathetic innervations of the parotid gland. There's another set of fibers that come from the internal carotid plexus, which surrounds the internal carotid artery, and those are called the carotico-tympanic nerves. These fibers enter the tympanic cavity through the carotico-tympanic canaliculi and join the tympanic plexus, contributing sympathetic fibers to it. So if you look at it in perspective, we can actually see the glossopharyngeal nerve giving off the tympanic nerve, which enters the middle ear and forms the plexus, from which the lesser petrosal nerve takes off heading towards the otic ganglion. And alongside this, we've got the internal carotid plexus, which surrounds the internal carotid artery, giving off those carotico-tympanic nerves, supplementing the plexus with the sympathetic innervation. Now, let's look at the posterior wall of the middle ear. We can see the facial nerve, cranial nerve 7, running in its facial canal. As it travels, it gives off a small branch to the stapedius muscle. That branch exits through a small projection called the pyramidal eminence, and it's within that little hollow that the stapedius muscle sits. This muscle inserts onto the neck of the stapes, and when it contracts, it pulls the stapes away from the oval window to dampen the vibrations, basically acting as a secondary layer of protection against loud sound. That contraction is controlled by the facial nerve. Now, while we're talking about the facial nerve, another branch it gives off is the chorda tympani nerve. That nerve enters the tympanic cavity through the posterior canaliculus, crosses over the tympanic membrane and the malleus, and exits through the anterior canaliculus to go towards the infratemporal fossa, where it joins the lingual nerve. It carries a taste sensation from the anterior 2/3 of the tongue and parasympathetic fibers to the submandibular and the sublingual glands. If we now look at the anterior wall of the tympanic cavity, one structure we see here is the tensor tympani muscle. Remember, this one originates from the cartilaginous portion of the auditory tube and the greater wing of the sphenoid, and inserts into the handle of the malleus, again helping to reduce the amplitude of sound vibrations. Right next to it, on the anterior side, we also find the opening of the auditory tube, or eustachian tube, which connects the middle ear to the nasopharynx. This tube helps equalize the pressure between the middle ear and the environment. So that was everything for the tympanic cavity, and with that, we've covered the middle ear. Alright, now let's finally do the inner ear and figure out how we actually convert sound into electrical signals that our brain understands. The internal ear is represented by the vestibulocochlear organ. Let's zoom in on it. This is such a beautiful little organ. I want to switch over to a 3D model for a moment to see it in detail. The inner ear is divided into three parts: the semicircular canals, the vestibule, and the cochlea. This organ has two functions. The semicircular canals and the vestibule are responsible for maintaining balance, while the cochlea is responsible for hearing. Just before I continue, remember what those two holes were called? The oval one is called the oval window, and the round one is called the round window. Again, here we see the eardrum, the malleus, incus, and stapes, and it's the stapes that's pushing against the oval window. The round window has a membrane, and that's why we call it the secondary tympanic membrane. Anyways, the round and oval window will be important very soon when we talk about the hearing mechanism, but let's cover some more structures of the inner ear first. Now, the vestibulocochlear organ is divided into two parts. The outer shell is called the osseous labyrinth, and inside that there's the membranous labyrinth. The osseous labyrinth is bony, and the membranous labyrinth is a fluid-filled sac. Make sense so far? The three parts we mentioned earlier, the semicircular canals, the vestibule, and the cochlea, are regions that contain the osseous labyrinth. Now, let's fade the osseous labyrinth and focus on the inside for a moment. Inside the semicircular canals, we find the semicircular ducts. We have an anterior, a posterior, and a lateral duct. And there's also a common membranous limb that connects some of them together. We can also see the utricle, the saccule, and the cochlear duct. And then we have the endolymphatic duct, which leads into the endolymphatic sac. These lie deep to the dura mater in the posterior cranium. And one thing to keep in mind is that the membranous labyrinth is a closed system. It's a pouch. And the fluid within it is removed by reabsorption via the epithelium of the endolymphatic sac. So these are all part of the membranous labyrinth. Other things we can see is the ampulla, which is the widened base of each semicircular duct. All of these fall under the membranous labyrinth, so that's generally how we divide the bony and the membranous labyrinth. From personal experience, it makes so much more sense to go through all of the structures of the inner ear before we talk about the actual function. Now, this is where the interesting part of this video starts. Ready? Between the osseous labyrinth and the membranous labyrinth, we've got something called perilymph. So perilymph covers all of this area between those two structures. Within the membranous labyrinth, we've got endolymph, which fills the inner compartments. These two fluids never mix, and this is really important because even their chemical composition is different. The perilymph is similar to extracellular fluid, so it's high in sodium and low in potassium. Endolymph, on the other hand, is similar to intracellular fluid, or cytosol, so it's low in sodium and high in potassium. This is super important to know because it will come into play in just a minute when we start talking about the functions of the hair cells. And again, remember, these two fluids do not mix. Alright, I'm going to make you an expert in the hearing system by the end of this video. Now, we divide the inner ear into a vestibular system for balance and a cochlear system for hearing. Let's do the vestibular system first. The vestibular system is made up of two functional parts: the three semicircular canals, which detect rotational movement of the head, and the otolytic organs, the utricle and the saccule, which detect linear acceleration and head positioning related to gravity. The semicircular canals are arranged roughly in three perpendicular planes. The anterior canal is responsible for detecting nodding motions, like when you say yes. The posterior canal detects movements like tilting your head towards your shoulders, and the lateral canal detects horizontal head turns, like shaking your head no. Each canal has an enlarged end called the ampulla, and inside the ampulla we have the crista ampullaris. That's the sensory organ that responds to rotation. It consists of the cupula, a gelatinous structure that bends with endolymph flow, hair cells, which are actually sensory receptors, supporting cells, and fibers of the vestibular nerve, which carry signals centrally. When the head turns, The endolymph inside the canal lags behind due to inertia and pushes against the cupula. This deflects the cupula, bends the stereocilia on the hair cells, and if deflected in the excitatory direction, that allows potassium-rich endolymph to enter the hair cells. That depolarizes the cells and sends nerve impulses through the vestibular nerve to inform the brain about the movements. Below the semicircular canals, we have the utricle and the saccule. The utricle is responsible for horizontal acceleration, like when you accelerate forward in a car, and the saccule responds to vertical acceleration, like when you go up and down in an elevator. Together, these are called otolytic organs. They each contain a sensory area called the macula. On top of the hair cells in the macula lie tiny calcium carbonate crystals called otoconia or otoliths. These are suspended in gelatinous layer and add weight and inertia. When the head accelerates in any of those planes, the otoliths shift and drag the gel with them, bending the embedded hair cells. That bending again opens the channels, potassium flows in from the endolymph, depolarizing the cell and sends signals through the vestibular nerve. If these crystals jump out of the place and enters the semicircular canals, they can actually cause a condition called benign paroxysmal positional vertigo or BPPV, which leads to episodes of dizziness. So that's the vestibular system. And signals from here are carried to the brain via the vestibular nerve. Make sense? That's how balance is perceived by the inner ear. Let's now do the auditory system. This one is such an interesting system. The auditory system is built within the cochlea. It is divided into the scala vestibuli, scala tympani, and scala media. These are wrapped around a central axis called the modulus, which is the tiny core of the cochlea that houses the spiral ganglion and blood vessels. Now, if we take a cross-section of the cochlea, we will be able to see those three compartments clearly. The scala vestibuli and scala tympani both contain perilymph, while the scala media contains endolymph. Why does this matter? Well, when sound waves enter the external acoustic meatus, they vibrate the eardrum, which then transmits that vibration through the malleus, incus, and the stapes. The stapes pushes into the oval window, transmitting that mechanical energy into the perilymph of the scala vestibuli. As the stapes pushes inwards, it sends a pressure wave through the perilymph, which is separated from the endolymph. That wave travels up the spiral of the cochlea towards the apex. The endpoint where that fluid shifts to the other side is called the helicotrema. From there, the fluid continues down the scala tympani and eventually dissipates at the round window. The round window has a secondary tympanic membrane that bulges outwards to accommodate the pressure of the incoming fluid wave. Now, as the perilymph moves through these chambers, it is going to exert pressure on the membranes that separate the scala media. The area above the scala media is the scala vestibuli, and below is the scala tympani. Alright, we've come this far, so now you may ask, so Time, how does this system understand sound? I'm glad you asked, and in order to understand that, we need to go through some structures. The vestibular membrane separates the scala vestibuli from the scala media, and the basilar membrane separates the scala tympani from the scala media. Vibrations in the perilymph cause these membranes to oscillate. And the most important of these is the basilar membrane, because there's a very important organ attached to it. It's the organ of Corti. Let's zoom in on the organ of Corti, which is the actual structure responsible for turning vibrations into electrical signals. This is where hearing really happens. The main sensory cells here are the hair cells, divided into inner and outer hair cells. The inner hair cells are the ones that detect sound and send information to the brain. The outer hair cells help amplify the signal and fine-tune the response. These hair cells are supported by different types of supporting cells. The internal supporting cells next to the inner hair cells and the external supporting cells next to the outer ones. Between them, we have the pillar cells, which form a triangular space called the tunnel of Corti. This is important for maintaining the structural integrity of the organ and helping guide how vibrations travel across the basilar membrane. It also plays a role in isolating and organizing the movement of the hair cells during stimulation. Sitting just above the hair cells is the tectorial membrane, a gelatinous membrane that extends over the organ of Corti. And projecting from the top of each hair cell are fine structures called stereocilia, which make contact with or lie close to the tectorial membrane. When sound vibrations travel through the cochlea, they cause the basilar membrane to move up and down. This movement causes the stereocilia to bend. Now, these stereocilia are suspended within endolymph, which is high in potassium and low in sodium, a composition that's very different from perilymph that surrounds the rest of the cochlea. When the stereocilia bends in certain direction, potassium channels open, allowing potassium from the endolymph to enter the hair cell. This causes depolarization, which leads to release of neurotransmitters at the base of the cell. That stimulates the cochlear nerve fibers underneath, and those signals are sent through the cochlear nerve. So again, the basilar membrane vibrates, the stereocilia bends, potassium enters the cell depolarizes, and a signal is transmitted through the cochlear nerve, which passes the cochlear ganglion and then continues on to the auditory pathway. Now, what if I'm speaking in a low volume? Or what if I'm speaking in a high pitch? How does this system discriminate that? This is where everything is going to make sense. Now, we've got the scala vestibuli, scala media, and the scala tympani. Imagine for a second that we roll out the cochlea. We're just rolling out the whole cochlea. What we're going to see is the basilar membrane. Above the basilar membrane is the scala vestibuli. Below is the scala tympani. Makes sense so far? Imagine now that a sound is detected in the external environment. That sound wave will eventually cause the stapes to push towards the perilymph of the scala vestibuli. That wave of impulse is going to continue along the scala vestibuli and then loop around the apex, which is called what? It's called the helicotrema. The wave impulse will continue along the scala tympani and then eventually reach the round window, which basically bulges outward to release the pressure. Now, as the wave impulse travels along the perilymph, some of that fluid is going to oscillate or vibrate the basilar membrane and cause it to react to that sound. But our body is so smart at discriminating the frequency and amplitude of that sound. And it does that because in reality, the basilar membrane looks more or less like this. The base of the basilar membrane, the base closest to the round and oval window, is the narrowest. And not only that, the base is also the stiffest. And this is perfect because the basilar membrane here is tuned for high frequency sounds. Towards the apex, the basilar membrane is the widest and is very flaccid and is tuned for low frequency sounds. Now, humans can detect sound frequencies ranging roughly from 20 to 20,000 Hz. We don't commonly use the extremes of this range, but we are capable of perceiving them. For example, if the sound has a frequency of 1600 Hz, the wave will cause the basilar membrane to vibrate at a certain location that is tuned for 1600 Hz. If the frequency is lower, say 400 Hz, the vibration will occur further along the membrane, closer to the apex. This is how the cochlea separates pitch or frequency. And now you might be asking, but Time, what if the person is speaking really loud? How does loudness affect the basilar membrane? Loudness is determined by amplitude, and that amplitude determines how strong the basilar membrane vibrates at that specific pitch. The louder the sound, the more intense the vibration will be at that specific pitch. The lower the loudness, the weaker the basilar membrane will vibrate at that same pitch. Make sense? So loudness is determined by amplitude. And normal amplitude hearing for humans is around 0 to 120 decibels. We don't usually experience the whole spectrum in normal life. If you look here, a normal speaking voice is going to be around 60 decibel. And prolonged exposure to loudness of about 85 decibels or more is damaging to the ear long term because it can wear out and even destroy those hair cells. And once they're gone, they don't regenerate. So in summary, how strongly the basilar membrane vibrates, that is loudness, can be low or high volume measured in decibels. Where on the basilar membrane it vibrates, that is pitch or hertz, can be high frequency sounds or low frequency sounds. So balance from the vestibular system is carried through the vestibular nerve. Hearing is carried through the cochlear nerve. They join together to form the vestibulocochlear nerve, the 8th cranial nerve, which goes to specific areas of the brainstem. And this path onwards is covered in the video about the vestibulocochlear nerve. And with that, we've now covered the detailed anatomy of the human ear, the organ of hearing and balance. We have covered the external ear, the middle ear, and the inner ear. I really hope you found that helpful. I've made free courses on other topics here on YouTube if you want to keep learning. Otherwise, if you want a handmade PDF version of this lecture, take a quiz to test your knowledge, or access an organized list of all my videos, you can find everything on my website. Thanks for watching, see you in the next one.